Hey, hello friends. Welcome in podcast with Dr. Priyanka. Today in this podcast, we are going to listen about thyroid and thyroid disease. So kindly stay tuned. So if you are a medical student or also non-medico, with the picture presented, you can see like thyroid is a small butterfly-shaped gland located at the base of the neck just below the Adam's apple. So it's a part of an intricate network of glands called the endocrine system. So the endocrine system is responsible for coordinating many of the body's activities. The thyroid gland manufactures hormones that regulate the body's metabolism. There are several different thyroid disorders that include hypothyroidism, hyperthyroidism, goiter, thyroid nodules, and thyroid cancer. So let's see what causes thyroid. So all types of hyperthyroidism or the hypothyroidism, there are the disturbance in the thyroid hormones which happens. For example, in case of hyperthyroidism, there is due to overproduction of thyroid hormones. So in such conditions, we are able to find out the disease appearing is the grave disease, toxic adenomas, subacute thyroiditis, Hashimoto's disease. So what is the reason over here? So there is exposure to excessive amount of iodide. So cold and sinus medicines, the heart medicine that is amiodarone or certain contrast dyes given before x-rays may expose you to too much iodine. So you may then be at a greater risk of developing hyperthyroidism, especially if you had thyroid problems in the past. The second thing is lithium. So this drug has also been linked to hypothyroidism. So left untreated for long periods, hypothyroidism can bring on a mixed edema, coma, a rare but potentially fatal condition that requires immediate hormone injections. So the treatment for this is removal of the thyroid gland for hyperthyroidism. So the thyroid gland may be surgically removed or chemically destroyed as a treatment of hyperthyroidism. Okay, so we'll now talk about signs and symptoms. How we'll get to know like whether you're suffering from hyperthyroidism, hypothyroidism or any thyroid disease. So what are the symptoms? Symptoms are the things which you say or which you feel. So feeling cold when other people do not, constipation, feeling nervous or anxious, weight gain even though you are not eating more food, joint or muscle pain, feeling sad or depressed, feeling very tired, pale, dry skin, dry, thinning hair, slow heart rate, less sweating than usual, a puffy face, a hoarse voice, more than usual menstrual bleeding. So blood loss is the most common cause of anemia, especially iron deficiency anemia. Blood loss can be short term or persistent over time. Heavy menstrual periods or bleeding in the digestive or urinary tract can cause blood loss. Surgery, trauma or cancer can also cause blood loss. If a lot of blood is lost, the body may lose enough red blood cells and that causes anemia. So these were the symptoms of hypothyroidism, guys. So now we will listen about the symptoms of hyperthyroidism. If the lady or if the gents is suffering from hyperthyroidism, the symptoms would be weight loss even if you eat the same or more food. Most but not all people lose weight. Eating more than usual, rapid or irregular heartbeat or pounding of your heart, feeling nervous or anxious, feeling irritable, trouble sleeping, trembling in your hands and fingers, increased sweating, feeling hot when other people do not, muscle weakness, diarrhea or more bowel movements than normal, fever and lighter menstrual periods than normal, and changes in your eyes that can include bulging of eyes, redness or irritation. So, both acquired and inherited conditions and factors can prevent your body from making enough red blood cells. Acquired means you are not born with the condition, but you develop it. And inherited means your parents pass the gene from the condition on to you. So yes, guys, we have learned about the thyroid disease, the signs and symptoms, and the causes of thyroid. Thank you for staying tuned. Think healthy, eat healthy, and love each other. Bye bye.